Okay, so our paraphilia was on pedophiles or pedophilia,
I'm Jazlyn Kingsolver.
and I'm Emila Meza. So pedophilia is defined as a sexual interest in prepubescent children. Pedophilia is considered to be a coercive / victimizing paraphilia because individuals who go out and act on their urges towards children will likely be non-consensual, and cause great harm to children. According to the DSM-5, pedophilia is classified as a pedophilic disorder. However, the indicators for the diagnosis are kind of vague. The indicator is defined as a person that acts on their sexual urges towards children. However, it does not define it if this means actually molesting children or just masturbating to child pornography. So this lack of clarity often leads to confusion, and since not all pedophiles act on their sexual urges, it's important to note that not all pedophiles are child molesters, and not all child molesters are pedophiles. Only about 50% of molesters are pedophiles.
Some of the possible causes of pedophilia are related to brain abnormalities, left-handedness, lower IQ, and history of sexual abuse. Previous research has looked at the structures of the brain in relation to pedophilia. Research has shown that pedophilia could result from lesions in the temporal lobe. Men that develop these lesions, even if they were previously healthy, may begin to molest children as a result of the lesions. Another area of the brain that affects people's likelihood of being pedophilic is the frontal lobe. Alterations to this area of the brain can lead to reduced cognitive flexibility and lower inhibitory control abilities, which could contribute to an individual molesting children. According to a study by Schiffler et al. In 2017, the research found that while there was no significant difference in gray matter of non-offending pedophiles and a controlled group, they did find a significant difference between offending pedophiles and non-offending pedophiles when it comes to the level of gray matter in the right temporal pole. When looking at the offending pedophiles, this gray matter volume was greatly reduced, and this reduction of gray matter is also linked to possible reoffending. Being left-handed or ambidextrous is also linked to pedophilia. Pedophiles are 3 times more likely to be left-handed or ambidextrous in comparison to the general population. Other things that could contribute to pedophilia are lower IQ or history of sexual abuse.
So in thinking about the demographics and who does pedophilia affect most, much of what we know about pedophilia has come from studies conducted over the past few decades of clinical or correlational studies of men who have committed these sexual offenses against children. Much less is known about pedophiles outside of clinical or correlational settings, especially because pedophiles who have no history of sexual conduct with children are likely to not make that public or known. But we do know that pedophilia is much more common among men than it is females. And there are rough estimates of the rate of pedophilic attraction ranging from 1% to 4% in both men and women. And there's an even smaller subset where both men and women pedophiles have interest in toddlers and infants.
How common is pedophilia? This is a commonly asked question in relation to pedophilia. However, obtaining reliable numbers of pedophilia as a preference disorder is difficult because individuals are typically unwilling to admit that they have a pedophilic preference. The prevalence of a true pedophilic sexual preference is approximately 1%, but upon further examining of general fantasies, this prevalence can be up to 5% among men in the general population.
So, in looking at the victim's perspective, child sexual abuse produces adverse and devastating effects on the victims. Um, a lot of offenders who are classified as pedophiles don't show a single trace of remorse of doing this. So, victims will kind of always experience a traumatic sort of almost like PTSD that will linger on for the rest of their lives. Some common long-term psychological and emotional consequences for victims slash survivors who have failed to recover include drug and alcohol addiction. And victims of sexual abuse usually show feelings of guilt and shame. And this guilt is compounded by the culture of silence in most communities where survivors of sexual mistreatment live. And we have our first slide of references and our last.